Sleep is super important because this is our day, it's 24 hours, and we spend a good chunk of that during sleep. And some of the bad things that happen to our body during sleep carry over during the day. So let's talk about the number one killer, obstructive sleep apnea. So we know by far sleep apnea is associated with diabetes, hypertension, and congestive heart failure. And the big thing with sleep apnea is you can't get into the deeper stages of sleep. You're always having arousals. And when you're arousing all the time, these stress hormones get released in your bloodstream. Let me throw out some names: epinephrine, norepinephrine, cortisol, growth hormone. And what happens when these stress hormones are released, your blood pressure goes up. And when your blood pressure goes up, does the heart have an easier time or a more difficult time working? And the answer is a lot more difficult. The heart's working harder and harder, and next thing you know, the ventricles in the heart are enlarging. It's called hypertrophy, and we know that left ventricular hypertrophy is highly associated with two things: sudden cardiac death and congestive heart failure. So it behooves us to identify patients with obstructive sleep apnea, because you know what? We have the tools and we have the weapons to treat sleep apnea appropriately in the year 2015. So when we talk about the correlation with sudden cardiac death, it's when you have structural abnormalities in the heart or these arrhythmias. And it has clearly been shown that whether it be through a release of these stress hormones or the effects of the heart working hard to cause the ventricles to enlarge and the atrium to enlarge, all these things put together contribute to that sudden cardiac death. So when I hear about a mobile heart testing unit, I love it. Why? Is because bringing medicine to the patient is the job of the doctor, of the healthcare practitioner, because of the fact that the number one killer in our country is heart disease. It's associated with diabetes and hypertension. If we could have devices where we could say earlier on, we could risk stratify our patients, know who's at that highest risk for developing heart disease and sudden cardiac death, this is something worth investing in. Join me, Dr. Raj, and the Wadinsky Heart Foundation to finally stop sudden cardiac death once and for all.